let's talk about the people that you've been serving and how they are right now in terms of you've been seeing some people actually do well.
Yes. Um, what comes to mind more readily than anything else is a husband and wife team that I was able to take care of. I had the wife was assigned to me first. And just through conversation, she was like, you know, my husband is here. And I'm thinking, here? How did he get in the hospital, like to visit? Because I know that, you know, there are no visitors. And she says, no, he's a patient. I'm like, well, why aren't you rooming together? And just because of the dynamics of the floor, they were not able to be housed together. And so we, you know, kind of got into our advocacy mode like us nurses do. And we were able to, took about a half a day, but we were able to get them to be able to room in the same room, which is great because even though you have the symptoms and, you know, the stress of having COVID, it was just so nice that they were able to heal together. But the bright side is that they went home. They went home after about 3 days. They were able to go home.
And that's because they tested negative?
Yes. What they do is they will, when you test positive, then after their treatment regimen or whatever, they will test you again. And they ended up testing negative and was able to be discharged. Now, they would have to quarantine when they get home. So they'll quarantine for the 14 days. They have an 18-year-old son. So they sent him, you know, to stay with a relative, and they were able to go home. So it was a happy time.
And you're able to help, you and the rest of the nursing staff help determine who is able to go home. You tell us how you guys communicate about those kinds of things.
It's
you're on
really
different shifts.
Yeah, it's a team effort. Of course, the doctors run the team, so to speak. They run the show, but we're real big in advocacy, keeping up with the numbers, working with the social workers and any other type outreach committees that's there at the hospital. Because what we're finding is, I think what even I forgot, what people are forgetting is that because you can't be out, so a lot of the homeless personnel are in shelters, and then once they come, if they test positive and they come into the hospital, those shelter beds are not held for them. So sometimes it's hard for them to be discharged back to where they came from. So social work, I have to say, is very, very busy as well. It really, this pandemic really takes all hands on deck. So, you know, once we see a patient, we're like, hey, you know, their temperatures have been okay for the past couple days. You know, they're no longer requiring oxygen. They're on room air now. They're up walking around. They're doing better. You know, what can we do to get them out of here? And by me working night shift, I'm not privileged to have a social worker because they don't work 24 hours. But we pass that on. It's like pass the baton, so to speak, to the day shift nurse and be like, look, it's this, and this in our report. Let's see first thing when the physician's round. The first thing we want to mention is, when can this patient go home?
Okay.
Yeah, we want to get them out of there because you can come to the hospital and get sick.
I've heard that. The last thing I want to ask you about is who takes care of you and the other nurses in terms of this is tough work mentally, emotionally. Talk about that a little bit.
I'm super proud to say that there have been a lot of processes put into place for the healthcare providers here with the agency that I'm here with in our ballrooms. They have kind of like an employee health type setup where we have nurse practitioners and we have physician's assistants that are just here for us. If you become symptomatic, you know, there's someone here to treat you. If you could get a common cold or anything can befall you because we're humans. And so they're set up. We also have a counseling service that has been made available to us for just those times that you need to de-escalate. You may need to talk. We have been encouraged, strongly encouraged through email, through text messages, that if you need to talk to someone, come down. Here's the number. Here's how you can reach that person. If you're not feeling well, take time. When we first came, it was very widely known that the requirement was that we work 21 days and then we would get 2 days off. But since then, you know, administration has been very responsive. So now you're able, if you want to work 14 days and take 1 day off, you can. That's the option I'm choosing. So my first day off will be on Sunday.
And you're looking forward to it, I know.
I am looking forward to it. But I have to say that, you know, I'm Georgia strong. I am Georgia strong. So, and we stick together. There's so much camaraderie here. I mean, just the spirit and the resiliency of the nurses kind of rubs off. We kind of rub off on each other. I'm happy to report that. So we are being taken care of. And we do have numbers. There are hotline numbers, you know, directly to administration, clinical leaders that we can call should any needs arise.
Okay. Well, I'm
Mhm.
glad about that. I'm glad you're doing okay. Thank you
Yes,
for these regular updates, and take care of yourself
I
and take
will.
care of other people. And as I said before, you're one of our heroes and we appreciate you. And I know you've got a long night ahead, so good luck
Yes.
with that. We'll talk
Thank you
again
so
soon,
much.
okay?
Thanks for having me.
Thank you.